Good morning, good afternoon, good evening, good night, wherever you are. Yes, so it is the morning show and we have Let's Talk in the morning. So we're talking about vaccine certificates, mandates, and some other stuff this morning all surrounding the whole vaccination drive. Yeah.
Your man say he don't like me. I don't like that you just call. You say you something. He make your man follow me on IG. Motherfucker unfollow them. No clue. But I still think about the nightly. I think about what it might be like if we link up. I know you have someone. I know, but I still wanna keep it and keep it a secret. I know you have somebody. I still wanna link up and keep eating up. Let it take this. Come let it take this. Let me just take a piece of the thing that never make a feel sweet. Let it take this. Say, okay, I want you to think about it. Think about it. I want you to think about it.
I'm thinking.
Think about it. When you're whining down the over, I push my foot to think about it. I want you to think about it. But there's no one other than you at all. There is no one could ever call you a fraud. Because you're hotter than them. You are the best overall. You're better than them. You are the best by far. You catch me flirting with an next gal, baby, me sorry. Yeah.
Yes, to be on the inside. So I wonder if anybody listened to the Prime Minister's press conference yesterday. Well, we know we didn't look at it. But yesterday they actually were going to start at 1:30, then they announced that they have to show it later on, but they did start early before 2 o'clock, the conference. And we see that our Prime Minister, he's a bit disappointed by the Tobagonians. He thought they would have been out there getting their vaccines, but they're very, very hesitant. Yeah. We see that the churches will be opening as well from Monday, 25% capacity. So all those who are asking for the places of worship to reopen.
Okay.
Hi, Suzanne.
Hi.
So Suzanne, what time it is over there? So we have Suzanne from England on the inside.
1 p.m. Kyra.
1 p.m.
Yep.
You can always pull it in place, eh?
Yeah, I don't know where the food going.
Right. So what's the vibration this morning? You see Mike on this basketball thing going, man? Yeah. So we're talking vaccination again, mandate? Yeah?
Yeah, certificates, all kind of thing happening.
Like you
Right,
went to
and,
sleep with basketball in your mind now.
Yeah, boy. You're overdoing it. Big up
Morning,
Candace.
Candace. So to be on the
Big up
inside.
the CEO. I feel I want to bring these people on this kind of, let me see their face, when they're telling me all this rubbish. Right. Yeah.
So, people think it's only in Trinidad and Tobago, we experiencing this whole vaccine mandate and vaccinate to operate and all these things, but no, it is not only in Trinidad and Tobago. Other places, other countries, the whole world, people,
Well,
is in this place. right? And some persons actually had concerns concerning the vaccine certificate. They had some concerns. So, Lion,
Yeah, that's
I put
some
it in a
certificate.
order there. The
Well, I started with
concern.
the first one. So here it is going
Yeah.
on. She can't get up crazy that way. It's what I realize. Mike, you see last night, if Jizan was there, last night was Kava Sutra. You gotta go back and
I
watch
know
it.
where Tristan was. Tristan, where
Mm-mm.
were you?
Which is Anita in there?
Subway. I
Oh,
fell asleep.
Jesus Christ.
All they watch back and all that. And so we going in there. All they don't watch over that boy. Them girls and them who had wages and
Yeah.
them girls,
Really?
I watch it.
Okay, I have to watch it.
shame.
I watch it. I watch it.
Yeah,
I watch
yeah.
it. Yeah, but if Jizan look at it,
We
Good
get
evening. As vaccine passports appear more and more likely in Ontario, advocates for vulnerable communities predict there will be problems if and when Premier Ford mandates a passport system. Maliha Sheikh has that story.
I immediately think of people just trying to go into a Tim Hortons, maybe to get a coffee, or trying to get in somewhere out of the rain, and they will be denied because maybe they don't have the right ID to go with the vaccine passport.
Tommy Taylor is a frontline shelter worker in Toronto. He says although a vaccine certificate would be a step in the right direction to keep all Ontarians safe, he hopes the province considers racialized communities and those experiencing homelessness before they unveil one, adding certain groups have been facing challenges throughout the pandemic. A poorly thought out certificate would further complicate things.
We're talking about folks who haven't had easy access to the vaccine because they might not be vaccinated, or people that don't have ready access to ID.
Today, leaders across healthcare, education, and municipal sectors met to discuss the necessity for a province-wide vaccine certificate. Ontario NDP leader Andrea Horwath tweeted this today, which reads in part, Ontario has access to experts and to BC and Quebec as examples. We can keep people safe and support economic recovery without leaving anyone behind. Dr. Amit Arya says before we push the certificate, efforts still need to be made to get more individuals vaccinated.
I want to point out that everyone who is at this point unvaccinated is not an anti-vaxxer. So there are many people who are unfortunately still facing barriers to obtaining the vaccine, people who just need that conversation, people who just have a few questions and are maybe on the fence.
Dr. Arya says when looking at the certificate through a health equity lens, he predicts problems being added to existing issues for certain groups.
The impact of the pandemic has been very hard on racialized Ontarians. These are communities that historically have mistrust of people in authority, police, so we have to ask ourselves, who is going to be enforcing the vaccine certificate? So that is something that could lead to further mistrust in racialized communities.
Taylor echoes Arya's concerns.
People who can't get online, are we going to have a phone system for people to be able to get this vaccine passport? Is this going to be something where if someone has their ID stolen in a shelter, they can easily get this so that they're not excluded from society?
The frontline shelter worker we spoke with says he hopes if the provincial government announces a vaccine passport system, they speak with homeless advocates beforehand to discuss how this is going to work for people who don't have access to proper ID. For City News, I'm Maliha Sheikh.
Yeah. So we're seeing, and it's true, some persons do not have access to the IDs. What about all those homeless persons on the street? Did they go and vaccinate them? And when it is you're going for a vaccine, you know you have to work with your ID. Mike, on that note, do you know that you can go and receive the Pfizer vaccine?
Huh?
You said you were waiting on the Pfizer.
Yeah, I know.
Are you aware that you can now, they have allotted, I think it's 30,000 or 50,000 to the public, the citizens, not they have for the children set aside already. They have for the healthcare workers. My plane here, my
No, I listening. It's only
right, but I'll let you know that you could go for your Pfizer now.
Yeah, I know. I heard
So
that
when you're going for
yesterday,
it?
Well, I mean, we're not going for it. When I
You
go in,
say,
my wife going too. I can't go by myself,
going
so
for
I don't
it?
wait. Yeah, I don't wait until
There's
she
some
say yes.
academia cookie you have in there, Jizan.
So I'll go for it. Don't worry.
Yeah.
So, just let me ask you a question.
Uh-huh.
It's only fast food that is beating her.
Oh, really? Only on the weekend.
Oh, okay. So back to show. Yeah, I can't go and take no vaccine by myself. When I go in, the wife had to
I
go.
mean, you can't go by yourself. You're going by yourself, you know.
No,
Exactly.
the wife go be unvaccinated and I vaccinated. So how we go balance a box?
She could go at her own time. When she take her time off, she could go
Nah, we doing it
and
together.
get it.
Yeah, we doing it
Okay.
together. Yeah,
All right.
we have plans, so we doing it together.
All right. All right. So yes, I think
How much
that
you say? How much you say they have?
is between 30 to 50,000. I can't remember the exact number, but it's a lot of Pfizer.
That little bit.
So
Nice thing about it is she can come like the vaccine patroller, but she and Ray. Ray and Chica, you get sure.
no, when I see it, I say Mike was saying he waiting for Pfizer.
You
And
see,
here it is. So all the people who waiting for this specific brand and this one and that one, now they have real option. It had one shot and done. It have the Sinopharm available, and now it's the Pfizer.
Jitan, tell us,
Yes, Liam.
tell us what's going on in England. Are they implementing anything along those lines, like you have to verify your vaccine, like they get into places? What they're doing about that right now?
Sure, no, you saying so. You ain't sleeper.
When I get my back by, I was asking 4 o'clock correlate by myself for them.
Who get you vexed last night?
Mike and the basketball thing, but yeah, just tell me how we looking in the UK there in regards
To be honest, I have not been following it, so I don't even know what's going on. I had a phone call yesterday about my vaccination, and I told them come back Monday, so I don't know what's going on.
Yes.
So they're coming home to you?
They're gonna call me back on Monday.
Okay,
There's some mixed views going on in the UK because I
But I know
right
some
now.
certain places that you have to be vaccinated to fly. I know that in place at the moment, so you have to have a vaccine to go there. So yeah.
Certain places in the UK, you have to have your vaccine to fly to those places.
Yeah, the Europe, yes, you have to, yeah.
So to go to London, let me say go in London, you have to be vaccinated.
It might be soon they might bring that law in, I think, here.
To go to London.
Yeah, so you see, because this is just not England, we are all different people from different countries. Our
countries, yeah, because people travel everywhere as well, you know. And London is a busy place.
Yeah, our view would be different because now when you're in Trinidad and you're only studying what's going on in Trinidad and you're not realizing that is a worldwide change.
It's a worldwide thing. It's not only just Trinidad or England. It's worldwide.
From different countries. You find that your mind will be locked in a China, you know. Man, this man. Look, I mean, the passport is there in New York already.
Yeah.
Say New York, it's to come in New York. Look, Equinox, I want to go Equinox gym in New York. Bad.
You have to remember.
Bad. You can't even walk in Equinox to wipe the floor without your vaccine.
But you have to remember, Sholon, the UK and the US, they differ in many ways. The laws are completely different. So not everything that takes place in the US, the UK sublimed it. So, but I'm trying to follow some stories in the UK right now.
We are very behind America, more different from here. You're right. Yeah.
Yep. Since it started.
Even movies and shows and that we quite behind. England don't follow. Yeah, we are really behind. Yeah, certain things. Yeah, so yeah, it's different.
So again, we're seeing that on the world stage, the first world countries, the superpowers are leaning towards that. You can't go in Beijing without your passport, like China. You can't go to New York without your passport. I mean, if we're not following the trend here, I think we're not being reasonable in the trend that was happening in the world right now. If we go in and play with ducking, but just know you can't go to Tobago without a passport.
Passport, exactly.
So. And that's our twin island. You can say right, Trinidad and Tobago.
Yeah, exactly.
It's not so.
So Ontario is Ontario, yeah. It's rolling out the vaccine certification plan. So you'll take a look at that. Yeah, we can take a look at that. Yeah?
Yes.
Hopefully.
Yes, because they had the advocates before because the plan wasn't really so much in place. So later on in the week, they actually reveal how it is being done. Yeah.
All right, cool.
Good evening. Welcome to City News. I'm Adrian Gobriel. The Ford government has made vaccine certificates official for Ontario. It all gets underway on September 22nd. We begin tonight with the details you need to know.
We've landed on a vaccine certificate policy that is based on evidence and best advice.
Vaccine policy for Ontario has seemed inevitable for weeks, if not longer, though for months, Premier Doug Ford has resisted the advice of doctors and experts from across the province.
The answer is no. We aren't going to do it. We aren't going to have a split society.
Speaking publicly to the media for the first time in 5 weeks, Doug Ford reluctantly rolled out his government's plan.
That this is what we have to do right now in the face of this fourth wave.
Starting September 22nd, you'll need to show proof of vaccination to enter restaurants, nightclubs, event spaces, gyms, sports facilities, sporting events, concerts, cinemas, casinos, and racing venues. Though there's a substantial list of non-essential businesses who were previously closed for months, where you won't have to show a vaccine certificate, including retail stores, salons, and places of worship.
Why leave so many places off the list if one of the reasons for this vaccine certificate is to keep businesses open?
I'll pass that over to Dr. Moore.
If the risk increases in other venues, we can and add and implement additional measures to protect Ontarians.
Children 11 and under who cannot get vaccinated will still be allowed into spaces where a vaccine certificate is required. When the program begins on September 22nd, eligible vaccinated Ontarians will have to download their proof of vaccine PDF onto a phone or print it off to present to a business along with a piece of government-issued ID. On October 22nd, the province's Smart Health Card app will be ready for the public. It includes a standardized QR code that can be used across the country. Quebec's new app, called VaxiCode, went live today. When pressed by City News about the delay here in Ontario, Premier Ford kicked the hot potato to the federal government.
And what do you say to the people of Ontario who are frustrated that it's taken this long?
After finding out that the federal government just 3 weeks ago, said they weren't going to have a national passport. Instead, they decided to go with an unnecessary election.
While the opposition at Queen's Park are pointing the finger directly at Ford.
The Premier has obviously been dragged kicking and screaming to this point. So here we are, as I said, last minute Larry. It looks like this government is more interested in not offending anti-vaxxers.
As today's announcement got underway outside, protesters and anti-vaxxers took to the streets of Toronto by the hundreds.
And let me be clear, this is a temporary tool that we won't use for a day longer than we have to.
And the province will be releasing additional guidance to businesses when it comes to the new vaccine certificate rules. Still lots to work through, and we're still light on many of the details.
Right. That is interesting, eh? It is interesting that they have a list of businesses that requires the vaccine certificate and some places that don't require it. So it's like some things are really privileges. So when you think about cinemas, gyms, restaurants, casinos, those places, those are for pleasure. And as a result of that, to enter into those places that you want to enjoy yourselves, right? That is where you need to have that vaccine. If you want to, what they're saying is if you want to have a good time, you have to have a passport.
If you want pleasure,
yes,
you need to provide your passport, Mike. If
so you can go to the grocery. Yes, you can go to the grocery. You can go to the retail store, buy your underwear. You know, then no people it's necessary.
I'm not buy no more underwear. I wear my holy
No.
jewels. I wear
No,
some.
you can go and do that. So you see they have the list of businesses,
Right.
retail stores, the
Gym,
grocery. You don't need it.
leisure, and
I go
And
walk naked.
pleasure.
I go walk naked.
inside.
I go walk naked.
Leisure and
Walk
pleasure.
with your passport.
So
So if you want
Jason,
to go and sit down in the movie, so that back in the day, Mike would have been glad. Remember the story Mike gave us with the young lady? He would have said, there is no scene.
Yeah, Mike,
He would have get
if you want the pleasure center,
no pleasure center. Well, the thing is,
have
when
your
these
passport.
ladies,
walk with your
when
passport.
But
Really?
but
Let me
Sholan,
hear what she gonna say.
but Sholan,
Really?
Sholan, when the ladies have to go to those shops, they have to show their passport.
If you
No,
want
no, Mike. If you have to go Wonderful World, you don't need to show it.
No, no, no.
You
It's
can
I'm
go
talking
very
about.
detailed.
You don't have to show it, Mike.
So what about
No.
What about the
If
other
you want to
shop?
go to the resort
if
and you
you
want to go
want
double
the
palm, like
pleasure,
how Riri want to go double palm, you have to show your passport.
passport
Yeah, but what about the
before
other
you
shop?
come.
No, the other shop.
Yes, indeed.
The other shop are talking about. The other shop.
I know which shop you're talking about now, Mike.
The toy shop.
We got to tell
Morning, Silas.
The toy
Oh,
shop.
yeah.
Do they have
Oh,
to
yes,
show
you will.
passport for the toy shop?
No, it's a retail. That will be retail.
That will be retail, Mike.
So let me had Kama Sutra last night. Where you was, Gil?
Yeah, but that program was a
I
boss
fall
last
asleep
night.
early. I fall tiredness.
How you tired, sir?
What? Hey, watch
What you
that.
doing,
She
sir?
partying too much.
Man.
No, I had a busy week.
So it's whole week you're partying?
Exactly. Exactly.
I didn't party all week.
Oh,
You
my.
party 4 days?
Yeah, 4 days I party.
And the 3
Tired.
days is for rest?
Yeah, that's right.
Well, if you in a digital barcode system, I
Yeah.
didn't think
Yeah.
you all to listen to the Prime Minister address. And he slightly spoke about it in the new budget that it would have some additions in the budget that they didn't really cater
Yeah.
for. And it is
And it
along
have
the
some-
line of tech
Mm-hmm.
for the Ministry of Health. I want you to understand. He say along the lines of tech for the Ministry of Health. And if you notice, the backbone of this system right now is a technical barcode that the government will issue to you to validate your certification. This would have been nice for passports and driver's permits. I would have liked to see this technology be used for passport, ID card, and driver's permits. So that when you have to renew your thing, Chica, you have to go and this could filter into a lot of things. Eh? That now the police could scan and get your correct driver's permit because a lot of counterfeit and a lot of ID, the ID stealing and stuff is going on. But I want you all to understand that this is happening. Eh? You could protest how much you want, You have to pay, you have to keep the lights on sometimes. So you can't protest all day, whole night, You could go out in the street and protest, and your water get cut, your lights get cut. You can't buy grocery, and everybody in the parliament sit down with calm laughing and jamming laughing at you while you're in the street in a placard.
Yeah.
Right? Them could go on an island and rock back and still let them protest.
Exactly.
Right? And they protest.
Exactly.
And when it's time to cut your lights, they're coming right back by the same government for assistance. Right? And people, I want you to understand, it's them TTV cameras and them. One thing England has good is monitoring.
Yes, that's
So
right.
don't feel you're going and protest and so placard on your face and with a real good facial recognition in Scotland Yard. Yeah, why the only backward on the thing. Scotland Yard have good facial recognition. Them could nail you the thing. So
That's so true.
And what people understand, when you put your face, don't feel like myself in here because they're going to all who are vaccinated. And they realize, oh, you are part of this clique and they deem you as a hazard. You have no government assistance to get when you're hungry. You have no nothing. When government time to give out money for government assistance and mental assistance and people who lose This are they're going and do that, Mike. The people who lose money in COVID, they organize it to get them back on the foot with some monetary assistance.
Yeah, but that been coming long time, you know. That's not
Yeah, so what I'm saying is that be very careful of where you put your faith, where you put your voice, because you go make yourself a target. Be extremely careful, especially UK and Scotland Yard. Them don't know all who was marching that morning, eh? Them don't know all who was be very Canada too. That facial recognition.
And you see them with the sign, freedom, not fear. And all these things on the placard.
Listen.
Be very careful.
When you, for years now, when I used to be coming back and forth, from the time you see you leaving Gatwick, when you reach by that counter, there's 3 cameras. One facial, 2 on the side. That's snapping you one time.
They do that in Beijing too.
So that has been around long time.
Long time, exactly.
It's just a matter of advancement now.
Them getting your biometrics and thing when you the same fingerprinting is used to go for your visa. They have your biometrics already, you know. Don't feel them in target already like a cow. So what I'm talking about is the free and now becoming slave.
When I was working at CCN TV6, and you talking about over how much years, we bought in the finger to enter the building. Right?
Yeah, biometric.
We got rid, the biometric finger thing. Watch me. If you leave the building before time to go on lunch, that recording the time you leave and the time you come back. So like if your lunch is an hour and you say, you see me, long time you used to dog them. But now, from the time you go through that front door, if your lunchtime start 1, if you decide to bust it like 10-2, you have to put that finger there. Exactly. Yeah. So they talking about what?
Yeah. So we discussing now the variants. We have some new variant in the UK.
Is it?
There are some variants again.
All over.
All over have variant. All over.
I find the UK getting real blast with this variant thing these days. All them new variants start in the UK.
Africa, all over.
Africa, everywhere have variant, new variant.
Anyway,
that's why we go here at Trinidad and Tobago variants and
anyway, all. Black people are right. The variants are them. So we have rights in England. Eh? We have plenty rights in England, better than the United States. Eh? So fellas,
no. Hey, the Taliban here, I don't know what they could do, you know. Oh.
Taliban always did. Right? We have more rights in England than in the United States. So all want to migrate. Better you migrate to the UK. Eh? All the people are weak skin color. Right. Variant time. Cause for concern. The variants. Let me get going. Easy.
Well, you may have heard of the C12 variant. It's been discovered by South African scientists, and some are voicing concerns about its quick mutation and its potential to evade vaccine protection. But is this something we need to be worried about? We talked to experts here about the potential of C12 and other emerging variants.
We're really at an early stage, and we have to give the science an opportunity to really examine and look at the issue.
The new coronavirus mutation was discovered back in May and is now spreading in most South African provinces and has also been detected in several countries, including England, China, and Portugal. It's believed that C12 has multiple mutations and could possibly overcome vaccine immunity. To what extent, if any, is still unknown. Right now, infectious disease specialist Dr. Gerald Evans says at this point, there's no need to worry.
What I would say, bottom line, is anything about C12 at this point is speculation. We do not know where it's going. It does not appear to be outcompeting the Delta variant.
South African researchers recently published their findings in a preprint that still has to undergo a peer review. But online, some experts are tweeting about it. Dr. Eric Ding with the Federation of American Scientists posted a thread about his concerns over C12's mutation rate, saying it's more mutations away from the original virus than any other variant detected worldwide.
Things I would say, looking at, the preprint paper that came out from South Africa, is there's a lot of speculation about what these mutations mean, because some of them we don't know if they necessarily confer any advantage to this virus or not.
And at this point, Toronto epidemiologist Ross Upshur is also urging calm.
So I think we need to get accustomed to hearing periodically about new variants.
According to the Center for Disease Control in Europe, there are dozens of mutations being tracked as we speak. Right now, there are 5 variants of concern, including Delta, Beta, and Alpha, 6 variants of interest, including Lambda and Kappa, and a long list of variants that are being monitored, including C12. Professor Upshur tells me scientists are coming together like never before.
Now there's huge sequencing capacity, and interestingly, South Africa, because of all of the research they've been doing in HIV and AIDS, has really remarkably robust and advanced genomic sequencing capacity, as does the UK, as does the US. And now they're creating a global network of sequencing. So as that expands into all parts of the world, we're going to start to see more and more variants.
And while it's unknown if C12 will be a threat just yet, both experts who we're just hearing from, they agree that it does need to be closely monitored. At this point, there does not appear to be any cases here in Canada. As for Ontario's case count today, provincial health officials confirming 525 new coronavirus infections. The 7-day average is now slightly above 700. The last time it was this high was in early June. There are now 336 people in hospital because of the virus, and 158 are in the ICU. And a small note about today's deaths. 3 of the 5 are part of a data cleanup and happened more than 2 months ago. Well, just over half of the province's caseload today is coming from the GTHA. Toronto is reporting 120 new infections. Peel is reporting 60. Hamilton is adding 42, while York Region is adding 30. Halton and Durham are reporting fewer than 20 new cases. Well, meanwhile, just over 31,000 shots were administered on Monday, with more than 11,000 being first doses. Ontario is just shy of having 83% of those eligible receiving 1 shot, while more than 76% are now fully vaccinated.
But their vaccine rates going nice over there, man. Yeah, so what do you think about the variants, though? Because every time we hear about variants coming up now we have... Good morning, Andy. Long time no see.
So, where are variants coming from?
I don't know. Remember, they say things mutating. It have mutations taking place. So when the cross is shown, mutate again.
That sounds like alien.
Mutations that take place, remember? Even us as humans, mutation takes place as well, you know. So it could either get stronger, depends on the location, it could get weaker. So it really all depends. But when you think about mutations, normally it gets stronger, it spread fast. So like in this case, it's really speculation because it didn't have enough time to see what the variants will do. So it's a lot of speculation. So it's only time will tell.
It's beyond speculatory because any virus, the virus wants to live. So the longer the virus stays circulating, the harder it would try to, become stronger. And be big of yourself, man. Yeah? So variant just means variation and adaptation. So what it's doing is adapting and trying to live. It don't want to die. It's just like a regular organism. It wants to live.
So you
right?
say,
so that's why you get so much.
So you say all who want to migrate can migrate to the UK?
Correct, Israel. Tell them I say that. Yeah, I say that. You're going on better. Right?
Yeah, it seems like a matter. So, Jason, make sure you have food.
Nice. So we going, if we are to run, we're going. Of course, we have food. Because you can eat it every day. So I know how to get a food.
Yeah, but I
ain't gonna go hungry by this. She always
But Jason don't cook. That's the thing.
No, I do cook, Mike. I do cook.
Right? So, I mean...
How Mike looking sharp, so? You have a date on? Looking sharp, eh? Yeah, you play everything there, innit?
He take a haircut to go and get vaccine.
I realize since after that basketball, you hit me hard.
Yeah.
This basketball talk now, Ole. What is this basketball thing about?
Yeah, don't worry, we'll fix that.
I have to hear that basketball talk. I have to go back and watch it.
So
right now, no governments are trying to get that vaccination on mass. I think in our country they want to do it school by school, Chica. That's what they're going to do.
Yeah, they're gonna, and so persons when say they don't have accessibility, because we know that they were saying that to travel and go to certain locations where the vaccine is being, it's very challenging for some persons. So that's why the Johnson & Johnson, they decided that those in the remote areas, it's like a mobile unit. So they drive by, do the drive-through, persons come out, they get their shots. So they're really going into the communities now. And in the cases of, let us say, the school children between the ages of 12 and 18, they're trying to widen that gap where, they have, a one location that is easily accessible, because persons were still complaining that the locations is not accessible to everyone. They find it too far, right? But as some persons rightfully said, if it's to go to Maracas or to go on a line, nowhere is too far.
Yeah, but just now to go Maracas, you have to get passport. So you see the difference with a regular, our local broadcast, they don't show people these kind of clips.
Yeah.
It's the only our local media.
Why would they? They can't.
Not here because then people would have an idea what's coming. Because it's like, when you weekend, I mean, we are independent, so we don't have to follow any.
Yeah. Rihanna was going to say something there.
Rihanna?
Yeah, I was going to say I'm leaving. So see you all.
All right. Okay.
You close?
Rihanna.
All right, cool. Yeah, a lot of noise.
Right? So, I mean, if you're looking at Canada, you're looking at the UK, you're looking at, England, I mean, New York, Australia. Yeah. So now you're getting to see China, right? You're getting to see what the country is really doing. Trinidad is not separate from the world. So, irregardless of what you think in your mind or what you believe, this is coming to pass. We talk about this months. This is last year we talked about this. And people saying they're going and rise up and stand up on Facebook. How long you could protest for without paying your bill? How long you could stand up in front of the Red House or the White House or wherever house in a SOE and not get locked up?
Exactly.
Right? So irregardless, this is happening. And whether you like it or not, because just like the line, just an organization she felt because she know she likes to get out there. In the parish and the parish. Pick up something. I wonder because they're going to have video on that Friday. I want you to be on for it till they go that video. Pick up something, anything. What
video? Oh, yeah, that video. Oh, my God.
If you see Desert bike. I waited for Friday. I'll tell you about one day. I had like a secret weapon. Someone she went to give a trouble. Pick up something, anything.
Shame on you. Shame on you. Shame on you.
Mike, where's your seat, man?
Me?
Yeah, yourself.
I could jump on a plane anytime, and get away from Sherland and them,
Don't worry, we go find you. Don't worry, I can jump on a plane. That's what we're glad you forget. We ain't no visa.
But, you ain't no visa. But but do you know, you don't need vaccine to enter the UK. You know that?
Yeah, because we are part of UK still.
Right. You don't need that.
Yeah, we
are part of the islands is a part. Yeah.
So even the US, you don't need to be vaccinated.
Well, they might have the stipulation that it go. But when coming to UK, as we don't need a visa, we wouldn't have to go through all the bacchanal and the paperwork and the whole kind of thing. We could just buy the ticket and go. That's the difference. So when you're ready to run, make sure you have a 10 grand in PT because you got to start with that.
And then you still have to take the PCR test.
Yeah,
72 hours.
10 grand, one side for one flight.
Yeah.
Return.
It might be more.
Right, so we're going to touch just the mobile vaccination that some of the countries using.
Yeah.
Before we wrap up. So let me look at some of the mobile
Run
vaccinations.
Run it.
You will now see more mobile clinics in places like workplaces, childcare settings, and schools. Toronto is expanding its targeted COVID-19 vaccine strategy. Mayor John Tory wants to see as many people vaccinated as possible ahead of fall.
The expansion will provide Toronto Public Health the capacity to host up to 200 mobile clinics each week, in addition to the clinics currently run by Team Toronto and healthcare partners. This, of course, is made possible by the fact that we have reduced to some extent the number of permanent mass vaccination clinics operated by the city and redeployed those resources to this mobile effort.
Mayor Tory says the data-driven approach will bring vaccines to residents in areas that have low vaccination rates or where there's a higher risk of contracting COVID-19. Torontonians will find clinics anywhere from places of worship to grocery stores, parks, and recreational facilities. A strategy the city says works.
Roughly half the vaccinations administered at our clinics and TTC stations last week were first doses, which means there's a need out there for these types of clinics for people who just haven't gone even to get that first dose.
Nearly 17% of Ontarians 12 and older haven't received their first dose, and nearly 24% haven't gotten their second shot.
Since May the 1st, in this city, the City of Toronto, 98.7% of hospitalized COVID-19 cases with known vaccination status were people who were not fully vaccinated.
The timing of this hyperlocal mobile strategy is key.
The most effective thing we can do in support of the school year is to get vaccinated.
The city says starting this week, they will focus on 3 specific age groups, 12 to 17, 25 to 49, and those who are 65 and older in neighborhoods with high numbers of unvaccinated people. City Councillor Joe Cressy says for the majority who still haven't rolled up their sleeve, the issue remains access, not opposition.
Many Torontonians still face barriers or questions that we're working to overcome, from mobility issues and language barriers to transportation access and technology challenges. Some people don't have an ID, and many frontline and staff and shift workers don't have the time.
While the city is focusing more on their vaccine mobile strategy, there are still 5 mass immunization clinics running across Toronto. There's no timeline on when those will be closed.
Yes, so you see any mobile units running, they have places, making it more accessible. And as they rightfully said, there are some barriers, right? So persons who have language barriers, and when it is, as with the Pfizer for the children, they actually said that they will vaccinate even, because we have a lot of Venezuelans here as well. So they also made sure that they let them know, and they make sure that they put it in their language so there will be no language barrier, and they try their best as possible to have interpreters or even nurses from Cuba or Venezuela on the scene, right? So to bridge that gap. Yes, so nobody could say,
so,
I have access.
Before we continue,
I want to today.
Yeah.
All right, nice. So,
what's going on today?
What's going on the bacchanal time?
So we have water cooking at 11. Right? We have water cooking. So we know that section.
You should run the video. Run the video during cooking.
That's what time. I'm cooking today.
You're cooking today again, already.
So what's happening at 5:30?
At 5:30 p.m. we have the effects of COVID-19 on the family, the blueprint, and the topic today is sexual abuse. And I want persons to really tune in, because we will be looking at different aspects of child sexual abuse, sexual abuse in relationships as well. Right? And we will be...
If sexual abuse is on the other side, and it's sexual abuse, you can't sexually abuse other people.
Hey, just remember, we need to put up disclaimers, notification.
that's for
when you're doing the show later.
What disclaimer and notification?
You're just putting up a disclaimer to the show. The views from whoever, whatever is saying, not even though it's true, but always remember when you're dealing with topics like this, especially on radio, put up disclaimers. So you just have to put a disclaimer to whatever, or I will say it. It's important.
So
but we can talk.
The bacchanal time, and I didn't have a disclaimer last night for the Kama Sutra because them girl and them went overboard last night.
Overboard, we have to watch that.
They didn't went overboard. They didn't went
overboard.
If I was there, I would have been overboard too with you.
Lord.
You know why? Because, yes, she can.
I was going to say that
sexual abuse. When the woman doing the abuse at my place call that public.
Who you asked that?
It is sexual
Giselle?
abuse.
When
but
a
we will
woman,
get to that.
when a woman is sexually abusing the husband, now I have heard now a kind of looking for bacchanal because that would be part of the hot seat as well. The man say no.
Yeah.
I want to get the thing serious. You can drink before I start.
And we'll also
We need
add,
to leave it for what you're cooking.
yeah, because I will add something.
And Jason says, I don't give a rasta.
Shit.
That is abuse.
That is abuse. When the man
it.
say he on the mountain and he fasting,
oh God,
and you're raping the man in the night.
Oh God.
Coercion.
Oh God. Take it or leave it.
That is abuse section. When he say he's not doing nothing.
And he can't scream for help. He can't scream for help.
And you're taking it. That is
I don't know about that, no?
Bad,
I made us say that we're talking about that too at 11. Yeah. So Michael, you go see all at 11.
Yeah.
And I started all the hot at 20. When the man say no,
means no.
Gonna catch you guys later.
Okay, bye.
Come now, baby, rise the temperature. Come now, baby. Touch it, shut up and bend over. Let your back do the talking over.
This is your way for basic or conventional raw nutrition. In fact, tune in every Friday at 6 p.m. Real Talk. And I've also been to Satellite Comments too.
Shut up and bend over. Let your back do the talking over. So back up.
Oh, I'm so city.
I got PM, baby. I got PM now. I fais petit temps, baby. I got PM now. I got PM, baby. I got PM now. I got PM, tandis. I got PM now. C'est genre de femme, mais l'argent bon tout là. Toujours à checker, n'est qu'à travailler dans l'état. T'as eu mes pouvoirs, t'as eu mes ça. Quatre motrices, vite des services de l'état. Adia, pas exigeant passé, yo pas souviré, depuis yo pas reprado. Dommage, ça yo pas laisser bouillir de l'eau. Si c'est pour manger, ou mettre check up mon resto. I got PM, baby. I got PM now. I fais petit temps, baby. I got PM.
你ก็ปืนจีน你ก็คาร์ก็เป็นหมักเนี่ย
I got PM now. Give me now. Give me now.
Yes.
Chérie, faut entendre. Let me see you. L'aime fait la chambre, moi fait lundi. De 7 à 19h, son jour.